The first one is extension of the arm. It is the opposite movement to arm flexion where the arm moves posteriorly. So on the extension of the arm, you just extend the arm posteriorly. That's what happens, a flexion and extension of the arm. Now, the second one is flexion of the knee. The flexion of the knee, the internal rotation of the knee, dynamic support of the medial collateral ligament, providing medial stability to the knee. So in the flexion of the knee, just flex the knee upwards. That is what's known as the flexion of the knee. Moving the flexing the knee upwards. Third one is adduction. Adduction of the wrist. Adduction of the wrist is the movement of wrist toward the midline. So this is the wrist. Adduction of the wrist. For the adduction, you just go rightwards. Abduction is leftwards. It's just moving the wrist towards the midline. It's moving the adduction, moving the arm towards wrist towards the right. It's called as abduction. Adduction of the wrist. Next is the depression of the mandible. For the depression of the mandible, you just open your mouth. For elevation, you just close your mouth. So depression of the mandible is just when you open your mouth. So depression of the mandible is moving the mandible part inferiorly downwards. It's called as depression of the mandible. Now after depression, it's dorsiflexion of the foot. Dorsiflexion of the foot is the upward movement of foot upward movement of foot and superior surface of the foot approaches the shin, like just moving the foot upward. That's it. When you move downward, it's plantar flexion. When you move upward, it's dorsiflexion. Next one is circumduction of the arm. Circumduction of the arm is the movement of arm in circular manner, and also the arm traces a cone. It's just like moving the arm in circular manner. It's known as a circumduction of the arm. Next one is pronation of the forearm. The pronation of the forearm is turning the hand forward so palm and the forearm faces down and upward. It just, the pronation of the forearm is just palm just facing downward, just upward. This is what called as pronation. This is supination. This is pronation, what I just discussed right now. Pronation. The next one is opposition. Opposition of the thumb. Eighth one. Opposition of the thumb is a movement in which the thumb touches the tips of other fingers and allows grasping. Just the thumb touching the other fingers, like any other fingers, just allows grasping inside that's what is called as opposition of the thumb. Just thumb touches the tips of other fingers. Ninth one is abduction of the arm. Abduction of the arm is a movement of arm away from the midline. So there's abduction of the arm is just moving the arm away from the midline. Adduction is when coming near to the midline. Abduction is away from the midline. Adduction is coming near to the midline. So what we're discussing right now is abduction. It's just moving away from the midline. And the last one is medial rotation of the arm. It's turning movement of arm toward the midline around its own long axis. So the medial rotation of the arm's medial rotation is when just coming to the medial part. When lateral, it's going the away part. So arm's medial rotation is when just coming to the medial part. This is what calls the medial rotation of the arm. Thank you.